Hello everyone, I'm Serra. I'm dietitian at Dr. He Obesity Clinic. Today we are going to do the interview with Dr. He. You are curious and asking questions about the weight loss surgeries, so with this interview we will explain all of them. Welcome, Dr. He.
Thank you. Glad to be here.
Okay, Dr. He, let's start with obesity. What is obesity?
Obesity is generally defined as having an excessive amount of fat in the body. The World Health Organization has various classifications concerning obesity. These subsegments are calculated by dividing the weight of the patient by the square of their height. The patients with a body measurement index between 25 and 30 are classified as overweight. Those between 30 and 35 are class 1 obese. Those between 35 and 40 are class 2 obese, while those above 40 are class 3 morbid obese.
Is obesity dangerous for our lives? What kind of disease does obesity cause?
Of course, obesity is deemed as a syndrome consisting of many diseases, especially including heart problems, lung diseases, and arthralgia. Additionally, it can be stressed that obesity causes cancer.
What is the best treatment for obesity?
The best remedy for obesity is taking precautions to prevent obesity. However, if a patient has become obese and cannot lose weight through diet or exercise, they may seek surgical or non-surgical obesity treatments.
What does obesity surgeries mean?
Surgical obesity treatments are applications where a patient is intended to lose weight through surgical operations. Sleeve gastrectomy and gastric bypass are the most popular methods.
What is gastric sleeve surgery and which patients are suitable for this surgery?
Sleeve gastrectomy, known as gastric sleeve, is an operation in which 80% of the stomach is removed along with the appetite-inducing center. After this operation, the stomach is reduced by 80%. Due to the removal of the appetite-inducing region and the reduced stomach, the patient loses weight through two ways.
You said their BMI should be 35 or more. So what does BMI mean and how to calculate the body mass index?
The body measurement index is a mathematical value derived from dividing the weight of the patient by the square of their height. This result shows the amount of fat retained by the patient's body. The patients with a BMI value above 35, which means they're class 2 obese, are eligible for surgery.
How is gastric sleeve surgery performed and how long the surgery takes?
The sleeve gastrectomy operation lasts approximately 1 hour. The surgeons enter the patient's stomach through 4 incisions. A camera is inserted through one of the incisions to inflate the inside of the stomach and view the operation. The stomach is cut loose from the surrounding fat tissue. The stomach is reduced by 80% with the use of medical staplers.
And how long after the operation can the patient return their daily life?
The hospitalization period of this operation is 3 days. The patient remains in the hospital for 3 days and 3 nights. We start feeding the patients at the end of the 2nd day. We release them at the 3rd day after making sure that the patient can drink and digest without problems. The patient is accommodated in our partner hotel for 3 or 4 days. That is to say, the patient can return to their daily life after the first week of the operation.
And how long can patients reach the ideal weight with this surgery?
Reaching the ideal weight after the surgery takes approximately a year. The patient loses specific amounts of weight in particular periods. For example, they lose 10% of their initial weight during the first month. This amount becomes 20% around the 3rd month. By the 6th month, The patient loses 30% of their initial weight. At the end of the 12th month, the patient will have lost 40% and reach their ideal weight. The patient no longer loses weight after reaching their ideal weight.
Can you tell me the advantages and the risk of the gastric sleeve surgery?
Mide küçültme ameliyatları eskiye
Gastric
nazaran
sleeve
günümüzde
operations
çok daha
today
düşük
are
riskle
conducted with
ameliyat
smaller
edilebiliyor.
amounts of risk when
Burada,
compared to the past.
gelişmiş
The reasons
cerrahi
behind
tecrübe,
this are surgical
kullanılan
skill and
malzemelerin
experience,
kalitesinin
increased
artması,
quality of instruments
ve
used,
anestezi
and better
tekniklerinin
anesthesia
gelişmesi olarak
techniques.
sıralayabiliriz.
Okay, which medicines patients take after the operation?
Of course, we medicate our patients accordingly after operations. The most important medication is the antibiotics they will use for the first 3 days. These will protect the patient from infections. The others are stomach protective pills. Our patients use them over a period of 3 months, where they will take one protective pill every morning on an empty stomach. And finally, there are the protein shakes given by our dietitians, you, to ensure the patient gets enough proteins for their metabolism.
What about nutrition? How are the nutrition process after the gastric sleeve surgery?
We prescribe a 15-day liquid and a 15-day puree diet following the operation. After these 2 periods, the first month, we start the solid diet. The diet plan after the procedure is the expertise of the dietitians. You may give additional information about the dietary plans.
After surgery, first 2 days we will making the intravenous nutrition, and then we will start with the with leakage test with blue water, and then if there is no leakage, we are starting the liquid diet for first 15 days, and we are supporting to you with the protein shakes, and also you can drink the broth or milk, iron, you have lots of things for the drinking. And then after 15 days we will start the pre-diet period, and then we are starting the solid diet period. But some things we have some forbidden foods just for 3 months, but after then you will start the normal regular foods. Our patients are coming from all around the world, so how can they get their medical controls in their country, and what symptoms they should consult a doctor in their country?
Bu obezite ameliyatı yaptığımız hastaları öncelikle
We hospitalize our patients for 3 days. The leakage test takes place in the hospital. After the 3rd day, the patient is transported to our partner hotel for 3 to 4 days. We take them back to the hospital for a final checkup 1 day before departure. The first week after the operation contains most of the risk. This period is spent near the medical team. We give our patients a diet plan which they will continue back home and inform them about the problems they might come across. The patients reach us directly using Aftercare WhatsApp group. If they experience problems such as high fever, respiratory pain, or extreme fatigue, we evaluate the symptoms and direct them to a hospital if necessary. As I said, these problems are more likely to arise during the first week, so we keep them here in Turkey. We ask for blood tests every 3 months post-op after they return home. We receive and evaluate the tests via WhatsApp and let the patient know if they lack any essential vitamins or require supplements.
If a patient comes from outside of Turkey, how many days should patients stay in Turkey?
Biz yaklaşık bir haftalık bir
We indicate a 7-day period of staying in Turkey. The first 3 days is the operation and post-op period. This is followed by a 3 to 4 day hotel accommodation. At the end of the week, the dietitian evaluates the state of the patient, and we see them off to their country of origin.
If patient gain weight back after the surgery, is there a way like a revision?
Bu ameliyatı olan hastalar yaklaşık
The patients who have undergone this surgery reach their ideal weight in 1 or 2 years. Some patients adopt the belief that they are healthy individuals with average weight and revert to their old eating habits, including high amounts of carbohydrates and calories. Or they might go back to consuming carbonated or alcoholic beverages. These types of behavior can lead to the re-enlargement of the reduced stomach and weight gain. We come across such cases in a ratio of 2 to 3%, especially 3 months after the operation. Such patients may require revisional surgeries. In such cases, it's possible to apply a second sleeve gastrectomy if the patient has obtained regular eating habits. However, if there's still a high calorie consumption, it's necessary to perform a gastric bypass procedure.
What would you recommend to patients who previously had a gastric band and he or she couldn't lose weight?
Gastrik bant uygulamaları
Banded gastroplasty used to be the most frequently used weight loss method up to 10 years ago. The last decade saw the rise of gastric sleeve and bypass operations. With the success of these two new methods, laparoscopic bands have fallen out of favor. When we are contacted by a patient who has received a gastric band surgery and couldn't lose weight, we recommend and practice the removal of the band laparoscopically and a sleeve gastrectomy or gastric bypass.
What is type 2 diabetes and what kind of difference between type 1 and type 2 diabetes?
Tabii ki diyabet hastalığı tip 1 diyabet.
Diabetes is classified as type 1 and type 2 diabetes. Type 1 is observed when diabetes has begun in young ages and the insulin secretion of the pancreas is very low or none at all. Type 2 diabetes develops after the ages of 20 to 25. And is labeled as the late emerging type. In these patients, the pancreas does secrete a certain amount of insulin, yet the tissues resist making use of this hormone. Subsequently, insulin fails to insert the sugar into the associated tissues, and there's a rise in blood sugar. Some type 2 diabetes patients also suffer from obesity, and the body requires higher amounts of insulin. When the pancreas cannot secrete sufficient amounts of insulin to meet these needs, the patient is diagnosed with type 2 diabetes.
What is the treatment for type 2 diabetes?
Tip 2 diyabet tedavisinde cerrahi gündeme gelebilir.
Surgical intervention comes up in the treatments of type 2 diabetes. That's not to say that all type 2 diabetes patients are eligible for surgical operations. The pancreas reserves need to be sufficient. We also have a test to measure this. Amounts of insulin while hungry and full, C-peptide levels, and previous blood sugar regulations of the patient determine if the patient is suitable for surgery.
Is gastric bypass surgery can be treatment for the type 2 diabetes?
Sure. While some type 2 diabetes patients are treated with gastric sleeve, we regard bypass methods as the primary treatment. Bypass is divided into various segments including mini-gastric bypass, Roux-en-Y gastric bypass, transit bipartition, and allele interposition. The common goal of these procedures is to intervene with the digestion of the consumed carbohydrates. By disabling part of the intestines, nutrients are passed onto the excretory system without digestion.
How is gastric bypass surgery performed and how long does this surgery take?
Gastric bypass prosedürleri tabii ki
all gastric bypass procedures have different durations, yet they last 2 to 2.5 hours on average. These operations are conducted through laparoscopic methods. Just like sleeve gastrectomy, 4 incisions are made in the patient's stomach. In an interval of 2 to 2.5 hours, a section of the stomach is disabled, and the small intestines are connected to the bottom of the stomach. The patient begins to walk in 3 to 4 hours. Because laparoscopic operations are usually comfortable, the healing process is therefore quicker and easier.
When does the patient discharge from the hospital after gastric bypass surgery?
The hospitalization period of the gastric bypass procedure is generally 3 days and 3 nights. The patient can be informed about the liquid diet period and released afterwards.
After the surgeries, can a person lose weight and get rid of the diabetes?
We can usually observe the improvements in the blood sugar once the patient starts being fed. We still prescribe diabetes pills to prevent the pancreas from secreting an excessive amount of insulin and exhaust the insulin reserves caused by the bypass. The patient uses these pills during the first month. We measure the blood sugar periodically and stop the diabetes pills by the end of the first month.
How should this postoperative feeding process be?
Of course, we recommend a diet rich in protein. This is crucial for diabetic patients. Our patients follow a 15-day liquid diet, followed by a 15-day puree diet, and finally start a solid diet. We recommend periodical vitamins and protein shakes. The diabetes pills are taken for the first month or so.
It's very similar with the gastric sleeve surgery. What are the differences between gastric sleeve and the gastric bypass surgery, and which procedures do you suggest to your patients? Gastric sleeve or gastric bypass?
Bir hastaya sleeve gastrektomi mi, gastric bypass mı yapabilmek?
The suitability of the patient to sleeve gastrectomy or gastric bypass may vary according to the eating habits of the patient. If the patient only has weight problems, we recommend sleeve gastrectomy since it's initially easier to tolerate. But if they suffer from severe hypertension or diabetes, gastric bypass may be the best option for them due to its digestion-preventing effects.
Can we talk about the vitamin and mineral tablets they will use for the rest of their life, or only for the 1 or 2 months?
Genellikle mide küçültme hastalarında
We usually prescribe vitamin supplements for 1 to 2 months to our patients after the sleeve gastrectomy. They keep taking these vitamins through the duration of their liquid and puree diets. On the other hand, patients who have done a gastric bypass procedure use vitamin supplements for the rest of their lives.
We talk about the weight loss surgery methods, but there are also non-surgical methods like a gastric balloon and gastric Botox. What is a gastric balloon?
As you've stated, the gastric balloon is a non-surgical weight loss method. We put the patient to sleep with the light sedation technique and view the inside of the stomach via endoscopy. We then place a balloon about the size of a grapefruit into the stomach to take up space and reduce the appetite.
Is there a need for body mass index restriction for the balloon? Who is suitable for this method?
The gastric balloon is generally recommended to patients who have up to 20 to 25 kilos to lose, or those who cannot undergo surgery due to serious levels of comorbidity or side diseases.
How is the gastric balloon operation performed, and how long does this operation take?
It's necessary to evaluate the state of the stomach prior to the operation. We need to check if the gastric balloon patient has a serious ulcer, gastritis or reflux. If these exist, we might decide against the operation. That's why we view the stomach through the endoscopy beforehand. If no inhibiting diseases are found, we place the balloon in the same session. This lasts about half an hour on average. The patient remains under medical surveillance for 2 hours until the effect of the sedation ends, and then they're released from hospital.
And there are 2 types balloon for losing weight. These are the 6-month balloon and the 12-month balloon. What is the difference between these balloon types?
Yes, the balloons have two main types according to the length of stay in the body and if they require additional inflation. Yes, the balloons have two main types according to the length of stay in the body and if they require additional inflation or not. The 6-month balloons are inserted and inflated around 350 to 400 cc in one session, are followed up until the 6th month and subsequently removed. The second type remains inside the stomach for 12 months and is inserted using the same method. These are inflated endoscopically every 3 months and removed after 1 year.
This operation includes any risks or complications? For example, is balloon may burst in the stomach?
There's no need to fear if the balloon deflates inside the stomach. We fill the balloon with a blue liquid, and the patient will identify a potential leakage if their urine turns out blue. In such cases, we remove the leaking balloon via endoscopy and insert a new one in its place. There are no additional risks other than cramps or nausea experienced in the first 2 to 3 days upon the insertion of the balloon.
I'm coming to the most curious question. How many kilos can patients lose weight with balloon?
Of course, this depends on the diet of the patient. We always recommend dietitian support for the gastric balloon patients. We also ask them to increase their physical activity level, such as going to the gym. The patients who follow this advice can lose up to 20 to 25 kilos of weight.
Bunları uygulayan hastalarda 20-25 kilo kadar kilo kaybı sağlanabilir.
The patient may gain weight back after the gastric balloon comes out.
Of course, if the patient reverts back to their former eating habits once the balloon is removed, they risk gaining the weight back.
How are the feeding process after the gastric balloon operation?
Since there may be cramps or nausea for the first 2 to 3 days, we prescribe a liquid diet. This is followed by a 2 to 3 day puree diet, and the patient finally starts eating solid meals by the end of the first week.
And there is another non-surgical method. Its name is gastric Botox. What is it?
Gastric Botox, midenin içerisinde
Gastric Botox is an operation where the surgeon enters the stomach endoscopically and numbs the stomach muscles and blocks the appetite-inducing areas by the use of a toxin called botulinum. This causes the nutrients to remain in the stomach for a longer period and the appetite to decrease.
Which patients suitable for this method? Are there any conditions?
We recommend gastric Botox to patients with 10 to 15 kilos to lose. For obese patients with body measurement index values above 35 to 40, this operation would not be a viable solution.
How is gastric Botox operation performed and how long does this operation take?
Mide botoksu işlemi, midenin gözlenmesi.
The stomach Botox procedure is performed by first inspecting the stomach through endoscopy. The Botox is then injected to around 40 regions in the stomach in a period of 30 minutes.
Is there any risk for this method?
Bu metodun herhangi bir riski yok.
There's no risk involved in this method. There may only be cases of minor bleeding due to the 40 injections in the stomach. This bleeding generally stops with no interference required.
When does Botox affect after the operation?
Mide botoksunun etkisi yaklaşık 1. haftasında başlıyor.
The stomach Botox takes effect within the first week and lasts for 5 to 6 months.
And how many kilos can patient lose weight with gastric Botox?
They can lose up to 15 kilos of weight if they follow a good diet and exercise.
If you compare gastric balloon and gastric Botox, which non-surgical method do you recommend to your patients?
Since the gastric balloon has been proven scientifically, it's considered the more efficient method.
How are the feeding process after the gastric Botox operation? Is it different from gastric balloon?
Mide botoksu uyguladığımız hastalarda
We prefer a more solid-based diet with our stomach Botox patients. The solid nutrients can remain in the stomach longer due to the numbed stomach muscles.
Do you want to say anything to our patients who are living in the abroad?
Our clinic serves mainly patients from overseas. Our surgical, dietitian and coordinating teams are vast and efficient. Our patients may safely trust our team and practices. Our primary concern is always conducting the operation safely and sending our patients back with no concerns.
Okay, thank you for your taking time.
Thank you.
Today we made a good interview with Dr. He, and he also answered all our questions. And if you have any questions, always you can ask to our team and you can take a support from them. And you can reach to us from Instagram, WhatsApp and Facebook. Thank you.